Pinch nerve, what is that about? Okay, so here now we have a model of the lower back, and in this model here, these points here, when you press into somebody's back, these are the points in which you're feeling. So that's the back, that's the front out here. This here is a healthy disc, is a thick ring around the jelly, and this structure here, it combines to serve the purposes of cushioning as well as to help the mobility of the spine. This right here, that's the spinal canal, so the spinal cord runs through here, and then the nerves exit the spinal canal in the lower back to supply the legs, and these are the exit points. That's your right, that's your left. You can see here the nerves are free to exit without any pinching. Now let's say with time, there's some sort of degeneration, some sort of injury that takes place. And what we see here in this model, as compared to the other one, is a weakening of the ring here. And now we have this jelly that is now beginning to bulge outward. And now there's the potential for it to infringe or pinch on a nerve that exits. If it bulges enough and it gets into the spinal canal, it can actually knock out the entire spinal canal and get symptoms on both sides. Now, in this case here, the bulging is not enough to actually pinch on a nerve, but if you look at it here, this bulge here is actually enough to pinch on an exiting nerve. And this nerve here, it is represented by the solar nerve, is now being pinched by this herniated or this bulging or this slip disc. Okay? The terms herniated disc, slip disc, bulging disc can all be used interchangeably in a sort of a loose fashion. Okay? So in this particular scenario, this nerve is being pinched. What we have here now, we have some rupturing of the ring, and now we have some fluid bulging out. Again, in the same manner in which this nerve exits here, in this model, a nerve will also exit at this point. So you can imagine if the nerve is exiting here, and this here is now pinching or bulging onto a nerve, that will cause a pinch nerve, which in this case would cause symptoms, tingling and numbness, possibly limb weakness on the right side. Also as well too, there's some arthritis here in this model. These extra growths you see here, these will show up as bone spurs on the x-ray. If you look at the healthy one, you see there's more disc height. There's also a loss of disc height, and there's also some extra bone growth here. Right? That's a bone spur that will show up on the x-ray. There's no such bone spur here on the healthy spine. In this case here of a very severe osteoarthritis, what we have here is loss of the disc height. And the thing about it is that when the discs lose height, the bones become closer together, and now you have potential pinch points here at the exit point. So in this case here, the bones have, the top and bottom bones have come close enough to the point where they're actually pinching on a nerve in arthritis. And again, look how dried up this looks compared to the healthy one. Okay, healthy, it's a severe osteoarthritis with disc bulging. In osteoarthritis, you can have disc herniation and disc bulging taking place. That will pinch on nerves, and that will also cause, in addition to pain in the back, symptoms down the leg, these sciatica type symptoms. Because sciatica really is a bulging disc that pinches on a nerve. Okay, it just so happens to occur in one of the roots, one of the nerves that make up the sciatic nerves. Okay, so sciatic to sciatica, it is a pinched nerve due to a herniated disc or even due to arthritis. So I hope you now understand a bit more as to what pinched nerves are and how they tend to look on the anatomy. So if you're having any issues with pinched nerves, sciatica, slip disc, arthritis in the back, you can call 747-5297, 308-3370. We're in Chincuna Road in Cunupia. If you have x-rays, whether it's the films, you can hold it up in the light, take pictures, send it on our WhatsApp. Those numbers I called there, they are on WhatsApp. Or if you have digital films from any x-ray place, you can send those films on our WhatsApp. And we can even write you an x-ray script, send it to you on WhatsApp. You take a picture of that script and you can go to our private x-ray place, do the x-rays, and then send them to us. And we can even look at the x-rays even before you come in for an appointment. Okay, so if you have any help, if you have any issues, you want our help, feel free to contact.